Today, Ohio hitting an eye-opening milestone. More than 1 million cases of the coronavirus have been reported in Ohio since the start of the pandemic.
This as the state saw more than 1,400 additional cases today. 78 more people were admitted to the hospital, and nearly a quarter of the state has started the vaccination process. While more than 13% is completely vaccinated, the state is racing to get Ohioans vaccinated. Today, the governor announced coronavirus vaccine providers can schedule Ohioans 16 and older if facilities can't fill appointment slots with the state's current eligibility. Right now, that's people ages 40 and up.
NBC4's Karina Chung has been talking to two healthcare systems about what their no-show rates are and how they're handling it week to week.
Well, both Ohio State Wexner Medical Center and Columbus Public Health say this is good news for Ohioans. Now, here at home, they say the no-show rates are low, but this will give them some flexibility. Avoiding vacant appointments.
There were some urban cities who said they were having some challenges filling up their slots, and then there were some rules. So I think it really just depends.
Dr. Mashika Roberts says she learned this with her latest call with Ohio health departments and the governor. Columbus Public Health's COVID vaccine appointments are fully booked week to week, but it has a plan in place to fill any gaps.
We have a no waste list that we've been working on for some time, and we've updated it based on who's eligible. So right now we've got about 200 people on that list.
Ohioans 16 years old and up will be able to get on this list soon. CPH's no-show rate for clinics week to week is typically about 5%. Ohio State Wexner Medical Center, on the other hand, says it's typically less than 1% for them.
We suspect maybe some of the small amount of no-shows on the first dose could be people who are scheduling at multiple locations and don't cancel their appointment with us.
Ryan Haley, who's the Senior Director of Ambulatory Services, says they're able to adjust quickly.
We have a pretty nimble process for, reopening some slots, whether it's 50 in a session, 100. Hey, we have 100 more doses than we thought we'd have at this point in the week. Let's go ahead and open them up at 8 a.m. for this afternoon. And pretty commonly, those are full within, sometimes less than an hour.
Haley and Dr. Roberts say they expect to continue the week as planned, but it's nice to know they have options if needed.
This does remove many of those barriers, and obviously there's still limitations on the number of vaccines we have, but we know that demand is there. And so if the demand is there and there are vacant vaccine appointments, we should fill those up.
And both health systems will start scheduling the next phase of people that's 16 and up later this week. Now, the number of appointments will be dependent on their vaccine allotment, which they'll know by Wednesday. Local for you in Columbus, I'm Karina Chung, NBC4.